Wednesday morning, everyone. It's wonderful to see your faces once again. That's awesome. And for those of you where I only see your names, it's nice to see your names as well. Be nicer to see your faces, but that's okay. We'll deal with that. Um, it's you probably were really surprised this morning. You woke up and the sun was beating into the windows, and it's oh my gosh, you just I love that walking out. And normally when I leave the last few days anyway, it's been dark out because there's been clouds and it's been terrible. But this morning I thought I was running late because it was actually bright outside. So but no, got here on time, and we're here to have another chamber chat. And this time we've got the commander in chief of the region of Waterloo, Karen Redman, regional chair. Karen, welcome this morning.
Thank you so much, Greg. And I want to give a shout out to all my colleagues in the audience too. Hi, guys.
Yeah, I always like to say when they all join in like that, like technically, we could actually make a change here, and and really shock the heck out of Bruce Lochner. I don't know whether Bruce is on or not, but we could just move a motion and get all the votes in, and it'd be all over with. Um, Anyway, we've got lots of things to talk about. There's lots of things happening in the region of Waterloo, but the first and most important thing, I think, because I think what we've really learned is, the unfortunate part, and the chamber, as you know, I've, been talking about it all the time, that we need to do different things when we come out of lockdown and into open again, because obviously the reason we went into lockdown were the things that we were doing weren't necessarily helping. It's kind of, I take the same phrase that Perrin Beatty, my colleague from the Canadian Chamber of Commerce, says. He says, actually, when a government has to call for a lockdown or a stay-at-home measure, it's a signal of failure, because, in fact, they weren't able to implement measures or practices in the workplace or in the public that kept us protected. So we've been calling a lot on doing some new things and different things as we try and struggle our way through to the end, because we are going to get to the end, because we know many of us on this call and many others are in the queue to get their vaccines. And I think, and I'm going to have Karen comment on this, because I think it's so important that people understand how public health is handling it on a local basis, and where they're, what's the holdup sometimes and what are the benefits. But I can tell you one great big benefit. Last Saturday, I had the opportunity to get my vaccine, not for any special privileges other than the fact that I'm an old person. And so I come into the queue ahead of a lot of other people. So I waited for my turn and I registered. And when I registered back in, I don't know, the third week of March, the notice I got back was, be patient. You're in the system. Your registration has been successfully received, and we will notify you within 4 to 6 weeks. Well, about 4 days later, I got a text saying, here's the link, go in and schedule the day you want to come in for your vaccine, and pick the location, by the way, where you would like to have your vaccine. And so I went in and I thought, Roan is just across the road from my office, so I might as well select that site. So I did, in fact, do that. And last Saturday at 11:20 in the morning was my scheduled appointment. So I did all of the right things. I waited till exactly, 5 minutes or 10 minutes, 5 minutes, I think, before my allotted time. And I jumped in the line with other people that were there, and literally never even stopped. Where the line was walking into the facility, and I noticed on the other side, the exit, it seemed to be that people were walking out at about the exact same pace as we were walking into the building. And I have to tell you, it was the most amazing experience of structure and choreography, if that's the right word, I have ever seen in anything to do with a mass type of a program. Literally everything is so well prepared. And I know a lot of you have probably had the experience of going into one of these sites, but I was just so impressed. And I was telling Karen before we brought you all in that I got my queue, I did all my registration and all the protocols going through, and I sat down beside the nurse who was going to put the vaccine into my arm. And there happened to be a clock right on a post that was there. And I looked up and it was exactly 11:20 a.m. And that was the scheduled time of my vaccine. So, I can tell you that without a doubt, and I've heard, I'm not the only person that had a great experience. Every single individual in every single site has had a wonderful experience. And I can tell you, it's all credit to public health of being able to put in the right measures, the right controls, and the right people doing the right things. And they have not missed any element of organization or structure. So let's talk about that just a little bit, Karen, because there may be some people here who haven't yet had the opportunity and would like that opportunity, because we want everybody to take the opportunity to get their vaccine. So tell us a little bit about what's going on and where we're headed, and how much longer is this going to be?
Well, it's going to be a while. And I have to tell you that I made the bold statement with the encouragement of all of my colleagues, but particularly Mayor Jaworski, to tell everybody to echo what former General Hillier was saying, and that's that everybody could have a vaccine by the end of June. And nobody knows the last day, an hour of June, a better or spring than Tom Galloway, because he was our countdown clock when we were launching the LRT for phase 1. And just remember, phase 2 is coming to Cambridge. We're getting through the TAP system right now. So I would ask everybody just to put your minds back to last September. And Greg, you kind of touched on this. And we were talking about we'd be lucky by midsummer to be getting vaccines. And lo and behold, we got vaccines at the end of 2020. And that was good news. And we recognize that some of the brightest minds around the globe, because this is a global issue, decided that they were going to turn all of their efforts to a vaccine. So the vaccine supply has been spotty, and it has always been one of the limiting factors as we rolled forward. Currently, we have several systems. There are pharmacies that have vaccine. It's AstraZeneca. It's coming straight to the pharmacies. Primary doctors are getting AstraZeneca for their populations and their rosters, and they're delivering it. I can tell you right now that with great confidence, we have administered over 120,000 doses of vaccine through the region of Waterloo system. It's really important to also underscore, like, public health has a huge role to play in this, but Shirley Hilton took on being the lead for our task force. And we couldn't do this without the Cambridge North Dumfries Ontario Health Group. They're helping with Rona. The initial clinic was decided by the province that would be at Grand River Hospital. That whole crew went over to 66 Pine Bush to make sure it was up and running. We've got the School of Pharmacy in downtown Kitchener. We've got Boardwalk, but we've also got other ways to reach high priority communities. What we know from the statistics and the disaggregated data of the impact of COVID-19 is its socioeconomic indicators. It is age that is really a concern for people getting COVID and having bad results, which is why we've prioritized by age. This is all dictated by the provincial government, but as well as Indigenous, racialized, and people in certain postal codes have been shown to be negatively impacted. Some of them can't isolate at home. Some of them have 2 and 3 jobs and they can't afford a day off. One of the things that Regional Council has been advocating for through the Association of Municipalities and Federation of Municipalities of Canada is to have paid sick days. And the federal government does have some, but for small and medium-sized businesses, it may not be enough, and it's not enough for some of these marginalized workers. So we have all of these systems coming together. And one of the things that we decided to do in Waterloo Region was to continue to maintain our own database called COVAX. And into that system, we put batches of people who, by the guidelines through the province, say they are eligible to get in line, to get into the queue, to get an appointment, to get a vaccine. One of the balances that the task force has to consider is we don't want all of the volunteers, the pharmacy techs, the doctors, the nurses, and the people at the clinics to have great big holes in their schedule. So we put the batches out. We do 2 or 3 weeks of pre-registration. We give people a link and they go online and they book anywhere in Waterloo Region that they want to go. We also will have mobile units. We've had pop-up clinics. We specifically have been targeting the Indigenous community. So anyone that self-identifies as an Indigenous person has had clinics where they can go where it's culturally sensitive, and we've had great uptake. So we're trying to target those areas and those people that we know are in the highest risk of a bad result from the pandemic. So all of those things are happening. Vaccine supply is still, we don't have a line of sight. We have Pfizer and Moderna coming in. AstraZeneca is coming to the pharmacies. And I suspect that there's some people on this call that have got AstraZeneca. My husband and I got one of those last minute calls last Sunday saying, if you can come in the next 45 minutes, we can give you your shot. So we went in and got it, and we've had no ill effect. So there are a whole lot of moving parts. There's a whole lot of groups. And one of the things that you have to recognize is that any time a group is put ahead, and the phases, there's 3 phases by the government, and there's not a hard start and stop. They sort of morph one into the other, is that anytime we move any group ahead, some other group gets moved behind. And right now we're looking at high risk people who have had organ transplants, who have had cancer. They are the ones that are now being put in the system. Greg, we could open it up to everybody. There are other public health units that have done that. And exactly your point, you're going to sit on that list for 3 or 4 months maybe. And what we've seen in the community is we went from people who had sort of vaccine rage, like where's the vaccine, to vaccine angst, where's my vaccine, to what you're talking about, which is vaccine euphoria when they get it. We recognize that there are still people who with vaccine angst because they haven't gotten a chance to register, but sitting on a pre-registration list for several weeks, we don't think is necessarily the right move.
No, it's always better to under promise and over deliver. And certainly that's what happened. But process, I think process is so important in this. And I'll tell you a little bit of a funny, I was actually going through Tim Hortons drive-through when on the radio, I always listen to, yes, Mark, I knew you'd have a thumbs up for the Tim Hortons. Going through the Tim Hortons drive-through, and I had 570 News on, which I always have on in my car. And they said that the Region Waterloo had opened it up for 60 and over. And, I got through the drive-through, pulled right into a parking spot at the Tim Hortons right then. And I went on my phone, and literally 45 seconds later, I was registered for my like on my phone in my car. So systems have been extremely well thought out by those in charge, not just on the physical place where you go and get your vaccine, but everything from how do I register, how quickly do people get back to me, how can you communicate with me, because you can communicate by text, by email, by phone. There is no possible way that if you have any awareness at all as to what's going on, that you won't be there when you get your call to come and register. So I just think, while there's nothing the region can do about supply, and public health can't do anything about supply, I think with what we are getting, there are no hiccups in the rest of the system. The only hiccup is in is in getting the supplies here and how quickly we can mobilize the rest of the people. I'm not sure what the number of vaccinations are at now daily at Pine Bush, but my understanding is they can do 4,000 a day there at maximum capacity. And when you go in there, you will, so for those of you who have been in too, you'll notice, they're not yet using the total facility. So you can actually visualize when you walk in that this can be expanded fairly rapidly, and more vaccinations can take place.
And Greg, if I can just add, the local registry system that we're using allows us to be nimble. So we can expand and we can contract, and we always have an eye on our vaccine supply. And I know there's a rumor out there that there's been a lot of wastage. We have something called a concierge, which is somebody that does nothing except at the end of the day call all of those people that say they can show up on short notice to make sure that we don't waste any vaccines. Some of the vials you can get 5 shots out of, and some you can get 6. And I have to say, our pharmacy techs have been amazing. And if we get more vials, once we take them out of the freezer, depending on the kind of, whether it's Moderna or Pfizer, we might get extra doses. There are people who don't show up. We really ask people, now that we have all of these sort of concurrent systems going on. For instance, my husband and I are registered with Region to get shots. We've already got ours through the pharmacy. So when I get my link, I will not take an appointment, because that would be duplication. So there are lots of volunteers, and I want to give a shout out to all of the library systems, the township libraries and all of the urban library systems had diverted much of their staff to manning the phones, staffing the phones, to make sure that when people asked for a phone call back, they got them. It's far better to use email or text, because it's much more immediate, and we have algorithms that can send out batches. But if we need somebody to dial and phone, the library system's been amazing. For any of you that have volunteered and not got called for the vaccine rollout system, we have months ahead of us, and people will get called. Typical of this region, the outpouring and the volunteering from the community has been overwhelming. So right now we have enough volunteers, but summer's coming, students get summer jobs. We will continue to need volunteers. So don't despair if you volunteered. You'll probably get a tap on the shoulder. We still have many months of vaccinating, and we have second doses that have to be administered too. So we're not through this, but the light is there at the end of the tunnel.
That's the other brilliant thing too. When I left Rona, I actually have my appointment for my second dose.
Right.
The time, the day, I don't even have to be smart, which I'm not. So it was probably a really good thing the region put that in place. But all I need to do is just show up and my allotted time, and it's just a brilliant system. Let's talk a little bit. I want to talk about some exciting things that are happening in the region and get your kind of impression or input on it. First of all, we have called for, as you well know, because you received the letter from the Greater Kitchener-Waterloo Chamber of Commerce, ourselves, and Waterloo Economic Development Corporation, calling for a more stringent approach, or maybe a more recommended approach, to mask wearing, especially in the workplace. Quebec government last week made it compulsory that level 3 ASTM medical grade masks are compulsory in the workplace. We had one of our local manufacturers, Eclipse Innovation, who are Eclipse Automation, actually, Steve Mai, who's an incredible entrepreneur, an incredible employer for the region of Waterloo, who early days started the process of manufacturing masks, both medical grade ASTMs, level 3s and N95s, and made a significant donation last week to the businesses in the region of Waterloo, $1.5 million
Wow.
medical grade masks that are going to be distributed through businesses. How important do you think this is, just from a personal perspective? I know there's a lot of political things and health things around it. How important do you think, Karen, it is that we make due consideration on what we're putting on our face and how we're protecting ourselves and others?
You know what? I think the information's always evolving. And I know initially we weren't recommending wearing masks, and I'm thinking of over a year ago, Greg. So I would have to tell you that I think there's been a coming of age. There's been more information. I cannot say enough about the local business community and how they have continued to step up and reinvent themselves in ways that are very effective. And you know, it's interesting because in early days, Canada sent some PPE over to China and was roundly criticized. I think what we have to realize is this is a global pandemic. And one of the things this pandemic has shown us is gaps through so many systems. Not having locally made PPE was a huge issue. And we saw places like Eclipse that decided that they were going to fill that gap. I think it's an incredible support to fellow businesses, but I have to give a shout out to Waterloo Economic Development, the Cambridge Chamber, KW Chamber, as well as Communitech for stepping up. Businesses understand the vocabulary of businesses. They understand the need. And when you all stepped up early days and said, we will be the one stop for business and there's no wrong door. So if you need to figure out how to access anything, come to us. And it's, and I'm forgetting Amber French is the name of her cooperative to
Supply and Protect.
So you know what? So thank you. So people have stepped up and found innovative ways to help each other. I think this act of generosity by Eclipse is amazing. I think better masks are a good idea. I think that because workplaces have been identified as one of the hot spots through some of the research that has emerged from the pandemic and where it's spread. And what we found in businesses that it wasn't generally from staff to patron. It was, especially in restaurants, it's patron to patron and staff to staff. But when you're working and you go and sit on your break or you eat your lunch, you take your mask off, and we're all social creatures. And that is probably one of the things that contributed. So I think better masks for businesses is absolutely brilliant. And generally speaking, people in Waterloo region have adhered to the public health guidelines. And it's one of the reasons why we have been able to keep the rate down. But we're in a whole new world because as much as we have vaccine, we have variants of concern. And it's why we need to care about what's happening in Brazil, because that's where one of the more virulent variants are coming from. It is totally predictable that any virus is going to morph. So it's not like this is a super bug or it's acting in a way that isn't predictable, because public health and immunologists will tell you that it is the way viruses react. It's one of the reasons why we get a different cocktail every flu season, right? They try to guess what the sort of défi du jour, we used to call the challenge of the day, will be with the flu. So we need to care globally. The fact that business has stepped up to business is a great idea. And I don't know, do you want to talk about rapid testing too, or we already talked about that? All of those things, another tool in the kit to help us do the right thing.
Yeah. I think that's kind of the case we've been trying to make, of course, to the provincial government as they, we go into lockdown and we start coming out. We're advocating all the time and saying, so what are you going to do? What are you going to do different? Because, evidently what we were doing didn't work because we ended up having to lock down. So what are we going to do different that's going to prevent that from happening again? And so we're continually bringing ideas forward. And one of the things that the latest one was prior to the rapid screening, which we'll get into, was the mask issue. And we learned so much. Steve Mai is a really a close friend of mine. I've known him for 21 years since he started. Him and two other gentlemen started Eclipse Automation in a very small little industrial plaza. Now have 1,000 employees, or in 3 different countries around the world. So really a genuine success story. But his knowledge on masks, he's relayed to me. It's really unbelievable. So I have taken a couple of the masks and given them to individuals who are wearing cloth masks in their workplace. And I said, well, put this one on. And how do you feel? Well, yeah, it's great. It fits nice. It's got a much nicer bridge on it that keeps tight around my face and goes right down under my chin. But it seems like it's just paper. It's so easy to breathe through. And I said, yeah, and it's about 100% better than the cloth mask that you've been wearing from an efficacy perspective. So, you can breathe better through them, because you know why? And this is what Steve Mai said to me in the beginning. He said, Greg, there's a reason why you can breathe through easily through a medical grade ASTM level 3 mask, because people that have to wear them, they have to wear them all day. And you can't design a mask with high efficacy and expect people to wear it for a 10-hour shift or 12-hour shift at a hospital and wear it every single minute that they're on the floor, unless you can breathe through it. And so they're designed in a manner to catch more. I think these are N93s or something like that. They're 93% effective. The next step up is a full N95 respirator. So they're very easy to breathe through. So we were recommending that. And I know that comes at a cost, but if government's going to invest money in helping them through this pandemic, that would be a wise investment to make sure everybody in the workplace are protected well. The other thing that we launched this week, along with our friends at Communitech and Stay Safe, and I got some really funny stories around that maybe we'll get into, but it was kind of a pilot project from Health Canada, Industry Canada, and the Ontario government. The one party really didn't understand that it was actually going to launch, and that was the Ontario government, until it actually did get launched. And that was my fault, but that's okay. Sometimes you're better to ask for permission or for forgiveness. But was rapid screening. And we've got 3 buses now in the region, thanks to the Region of Waterloo, who's provided 3 great buses that can move around and offer places where employees can go and get rapid screen. And then out of our office, we have the direct to SME pickup, where they can do self-screening right in the workplace. And just so you know, because I don't think I've updated you yet, by end of day Thursday, we will have about 50,000 test screening kits out in small businesses throughout the region of Waterloo, and wow, with over 600 businesses doing twice weekly screening of their employees to keep their workplace safe.
That's tremendous. And what an uptake. I think it shows you that there's a real appetite. And again, I want to underscore, nobody wants this pandemic to be behind us in the rearview mirror than businesses, right? Business have taken it on the chin. And I think this rapid screening, and again, the coming together of all levels of government, Greg, has been remarkable. I in my tenure, and I've been in politics a little while, I have not seen this kind of nonpartisan cooperation about doing what's right. And it's sort of an overused adage, but it's a little bit like building a plane while you're flying it. And a lot of the stuff has sort of been discovery through bumping up against things and trying to figure out how to resolve the issue. And again, business is really in a good position. And I don't know if this is a good pivot or too early, but Melissa has a screen. So you give me the high sign, Greg, whenever you think it's appropriate. But I want to really give a shout out to area municipalities in the region and the things that we've done to help business, because we recognize that they need help, that they've been on the front line of all of this. And I think it's just an interesting economic development looked at it a little while ago. And it just shows some of the things that we've all tried to do to help small and medium-sized businesses.
Have you got that, Melissa? She's got that.
She's got, it's a bit busy, and I apologize for that. But, and I don't know, Melissa, can you move it over just a little bit? Because it looks like Woolwich is getting squeezed out there. There, Sandy, the whole word. Um, so, you know, we've done advocacy to the provincial government and the federal government. And I'll just let you read, I'm not going to read the list to you, but it just really tried to come together and do things that were meaningful for small and medium-sized businesses. Some of the things that we asked for, deferral of the accommodation tax revenues to municipalities. Matthew Chandy of our economic development department at the region collated this. And Melissa, if you can just maybe scroll down, because I think it's a pretty long list.
Wow.
And Melissa has it if you want to share it with your membership.
Mm-hmm.
But it's just to say that we recognize that we need to be part of the solution. And we've certainly heard from the restaurant industry and caterers, as well as the request, and I've lobbied directly with the Premier for a more fair allocation when we go through the framework and the different colors, Greg, because as we go up and down, the rules have changed. And we can also talk about the ambassador program. Have you talked to your membership?
No, we should talk about that. Absolutely, bring that up.
So that we have are hiring 50 people who over the next few months will visit businesses. I think the thought is that they might go armed with some masks, which is also a good idea. Of the so are they N93? What are we calling them now, Greg?
I'm just calling them the only mask to wear.
Does everybody realize that when, like, for instance, an N95, the 95 becomes is that it filters out 95% of any particulates. So that's where that number comes from. So they're obviously highly effective. And these ambassadors are going to go around, and again, their first foray will be, we're here to help. You have the a safety plan, or do you have protocol in place that's demanded by this level of the framework, in order to make sure that small and medium-sized businesses have the information and the help they need in order to comply with guidance. I would love to tell you that we're going to be through this pandemic in the next couple of months, but when I got my second vaccination date, it's sometime in August. So I think we're probably looking at next fall, depending on how the variants go. There's so many moving parts to this. Melissa, that's great. I don't know if everybody's ready. You can probably take it down now.
Yeah, and we can provide that, Melissa, if you want to send a email to melissa@cambridgechamber.com. If you want a copy of that, she'd be happy to provide that. Really, Karen, when you look at the levels of government and the degree of the pandemic and this, the disruption that it's caused, there really isn't a lot of latitude at municipal governments to be able to deal with a lot of these things. So, anything, and I think I said that right in the very beginning, anything that a local municipal government can do, it is going to be a huge help, because the heavy lifting from a financial perspective needs to be handled by other levels of government. But there are all kinds of other moving parts that I think, for a great degree, the region and the local municipalities have really championed the cause of doing what they can do to help businesses in the region.
And, throughout this whole pandemic, Greg, one of the things that has hit me time and again is the acknowledgement of the provincial and federal government that regional governments and municipal governments are closest to the people and they know what the needs are. And one of the biggest challenges, and I'll go back to my days as an MP, I knew that what I was doing impacted the country and regions, and on good days, my community. But the reality was, to be relevant to your community is much more difficult at the provincial and federal level. When you're at the municipal level, every decision we make impacts families, businesses, the people we love, and our neighbors the next day or in the next few weeks. And we know what people need because they tell us. It's not that we're omniscient. And the business community has been very good at stepping up and saying, these are the things we need. These are the worries we have. You know, I think of one meeting that our CEO, Bruce Lochner, and I had with the restaurant community, and it was pan-regional, and Minto Schneider sort of facilitated it. And that's when we realized that absolute angst restaurateurs had about the mental health of their staff. And they're going back and forth, you know, they have a job, they don't have a job, they're laid off, they're back in. You know, they may do takeout, so they need fewer, but they need some staff. And it was the mental health of those people and that angst that really hit home for us. And these restaurateurs, sure, they were worried about their business, but they were way more worried about their employees.
Yeah, yeah, and I think that's I know there's a couple on this call right now that have, we've corresponded with quite a bit throughout the pandemic because largely, obviously, they're concerned about their business, but they're concerned about their business because their business takes care of their employees.
Yeah.
And it, everything's got to kind of work harmoniously so that that people are protected and have jobs and have incomes coming in and all of those things. I know, the protection of staff for most businesses is really critical. In fact, I know a number of companies who have actually put in their own rules and said, nobody comes into my place of business without a mask on. End of story, period, period, period. Because their employees have said, we're not coming back to work unless you demand that everybody comes in here is protecting us too. And that's wearing a mask or a face covering of some sort to protect the employees as well as themselves. So I think you're right. I've been really surprised for the most part. But what the region has really helped with, especially with this ambassador program, it's really hard when you're working 12, 16-hour days, trying to keep your business going and keep your people safe and happy, to really follow all of the protocols. So I think this ambassador program, and I think it's designed, if I remember correctly, to try and hit about 10,000 of those smaller businesses in the community to give them guidance and assistance in ensuring that they're doing everything they possibly can do to meet public guidelines as far as safety protocols and workplace safety for customers and for their staff. So I applaud the region for helping and assisting with this and making sure that this takes off. I know the federal government provided some assistance as well, but it takes bigger governments, and this, Karen, from being a member of parliament. And I don't want to say this lightly because we always complain about this, but it's pretty easy to write a check, but it's a lot more difficult to execute. And I remember going through the rapid screening process, and I said, yeah, we don't need any money to do this, the chamber. We just need the kits, because the kits are like $4 a piece or something like that. So we know you got the heavy lifting from the cost perspective, but this is going to be a bit of a challenge. Like, we're handing out thousands of these. And the reason why they've been sitting in warehouses for seemingly ever is because they didn't know how to mobilize it. They didn't know how to get the kits into the hands of people. And I think when you look at municipal governments and local businesses and local organizations, we need the support of maybe money, but also guidance, because we're really the ones that get the feet on the ground and get these things out the door. And the region's a big player in that, from the rapid screening to the ambassador program.
I totally agree. I mean, in so many ways, chambers are the connector. You're the trusted friend of business, and people. We all know people, right? And that it is about relationships and it is about trust. So I would agree with you. And great that the screening kits are getting out now. Great that we have a protocol. I know Nova Scotia was far ahead of us of doing this, so we had other examples. We don't need to reinvent the wheel. We just need to do it better. And
yeah. Yeah, we will, and so I'll quickly tell you this funny story because you'll appreciate it. The years that you've served in government and you understand how bureaucracy works, and they oftentimes trip over their stacks of policy papers, while they're trying to get a job done. But in any event, we were working on this for about 6 weeks, trying with Ian Klugman and Ian McLean and I, trying to get this program up and running in some fashion because we knew it was really important to get these kits out, so that we were hearing from business owners that they wake up in the morning, they put their first thing they do is they put their feet down on the ground beside their bed, and the first thing that comes into their mind is there going to be an outbreak in my facility that's going to shut my business down. They worry all the way to work, they worry while they're at work, and they worry all the way home from work that there's going to be something related to the pandemic that's going to disrupt their business, and it's not the greatest times for most businesses. So we knew that this was going to be a game changer for them. So we finally got the bus program kind of designed. I got the direct to the distribution system refined, and we were all ready to go. And so Ian McLean and I were talking on the phone, and Lisa in my organization was really doing a lot of the heavy lifting. Said, why don't we just go out? The bus program is going to launch on Wednesday. This was last week. Why don't we go out Tuesday afternoon late with the direct to business distribution program with a press conference, and we'll get that launched, and then it'll be kind of separate from the bus program. So what we didn't know while CTV was pulling in our parking lot out here and the media was starting to come and we were getting phone calls from the media and getting all set to do this was that there was a discussion or a call from the province, not to me, I was not involved, and said, no, we can't do this. We can't, this program can't, no, brakes on, put the brakes on full. Well, by that time it was too late. Ian McLean and I were live on CTV doing a rapid screening test ourselves. And I guess, and then on Facebook Live as well. And I guess the individual on the phone saw that as it was happening and was on the phone with the provincial government and said, I'm looking at a Facebook Live and DeRocher and McLean are on there launching the program and doing self-screenings themselves. So I guess the program is a go.
Well,
so, that's why sometimes you just got to do it, like get her done,
I'm going to go out on a limb though, Greg, and say that's probably the only time in your life you begged forgiveness instead of permission, right? An isolated incident.
You haven't had enough conversations with Lisa. It's always begging for forgiveness. There's no question about that.
Well, it's another tool in the kit. It's the right thing to do, and it's screening, and schools are doing it. It's not cutting edge anymore, but I think the way that we're implementing it is a really smart way to do it.
Yeah. Yeah, and I see some a comment here from Vanessa. Hotels are taking a mental beating as well. It's like the hospitality industry has just been shattered with this, and I know these are dreams that people had, and these are oftentimes a lot of the workers in the hospitality industry are fragile. It's difficult for a lot of them. And I know, the wage subsidies have helped, but the wage subsidies don't really help when you're told you got to lock your door. And you can't because you can't keep people on when, curbside. I think a lot of them have done some great things with curbside in redefining their business and how they can do better. But there's nothing like having your door wide open and every seat in your restaurant filled, or in Vanessa's case, every room in her hotel filled. We got to get back there, and the only way to get back there is to keep our noses to the grindstone, get our vaccines, and do the things we need to do to keep others protected. We can slow this or mitigate or stop this thing from spreading. We can get back to those things and going out for dinner whenever you want, and and doing the things that we all miss so much in the past year.
And Greg, I did give a shout out, but I want to give another one to all of my colleagues at the regional level, and hi to all the colleagues at area municipalities. But this would have been a really safe year to do a status quo budget. And we didn't do a status quo budget. We came in with 0% increase, and then regional council added in strategic things like investment in affordable housing, investment in the business sector to help get through the pandemic, which is part of the funding for the ambassador program from the region. And yesterday we dealt with investment in the airport and the East Side lands, because we recognize that this pandemic will be behind us and we cannot mark time. It's not who successive regional governments have been. It's not who this regional council is. And it's not what this community expects of the regional leadership. So we're continuing to invest. We know that brighter days are ahead, and we want to position Waterloo Region to continue to be one of the economic drivers in the province and in Canada. And all two-way all day go, which became everybody's mantra. And I have to tell you again, at other levels of government, when a community comes together, and it's the business community, it's the chambers of commerce, it's the high tech, advanced manufacturing, all levels of government, and they're saying the same thing. And we recognize that that kind of investment in that Toronto-Windsor corridor or Toronto to Waterloo Region corridor is going to continue to attract talent and investment and continue to allow us to be the innovative community that we are. And you cannot help but underscore the impact of two outstanding universities and a wonderful community college to say they continue to be inventive. I look at some of the microcredits that are at Conestoga College. I look at their emphasis on training PSWs, which again was a huge gap that was recognized through this pandemic. And all of those things continue to say that we will be ready for every opportunity when it presents itself, and we will seek out those opportunities. So kudos to this community and to my colleagues on this call for continuing to skate where the puck is going. We're not satisfied with the status quo, and we know that we need to continue to invest and provide leadership.
Yeah, well, thanks for the little precursor on two-way all day go. That's always that's kind of something that just rolls off of our tongues now in the region of Waterloo. But listen to Business at noon on Sunday on 570 News, because we're going to have Caroline Mulrooney, the Minister of Transportation, on this Sunday. And she's going to be making an announcement, I think, on Friday. And so we'll be.
I couldn't say, Greg.
I know. I'm pretty excited about it, actually, because we're actually gonna tape on Friday, right after her announcement. So she kind of screwed up my golf game, which was a little bit upsetting for me. But when you can get the Minister of Transportation to talk about your favorite subject, two-way all day go, I guess you got to cancel the odd golf game.
Now she's a good golfer. You should have asked her to go golfing with you.
Well, we did. And then she just didn't have 4 hours. So we offered her Golf Country Club or Westmount, whatever she wanted to go, but she couldn't do it. So there was a question here. Would it be appropriate to ask if 55 to 60s are ever going to be permitted to get the Pfizer or Moderna vaccines? And I know a lot of people I know, were concerned about the AstraZeneca vaccine because of obvious reasons. But my understanding is, and correct me if I'm wrong, the region of Waterloo is just going to open up when it gets to 50-year-olds. It's going to open up. You can go there, and it'll likely be the Moderna or Pfizer vaccine. At least that's what's in the sites now. But
so I would say that absolutely there will be a potential. So far, it's Pfizer and Moderna that we've had at the region, and it's AstraZeneca that has been at the pharmacies and through primary doctors. It's one of the reasons why I decided that I would go to a pharmacy to say that and most of you probably know that my husband Warren didn't know what to get me for Christmas, so he brought COVID home from the workplace, and we had COVID over Christmas. And my sister, who's a nurse practitioner in Rochester, New York, said to wait 90 days. So it was about 90 days, and we went and got the AstraZeneca. Two of his colleagues at work that had tested positive for COVID, one had Moderna and one had Pfizer, and everybody had sort of the same non-reaction from it. So yes, there will be an opportunity, but I have to tell you, the line of sight is always a little iffy. And I know somebody asked about the capacity. We're not at full capacity, and we keep sort of changing how many appointments we put out there, because we don't want people to be disappointed. We don't have to want to reschedule, but we don't want, our intent is always to get vaccine out of fridges and into arms. So our sweet spot is targeting on a day's extra supply, so that we wouldn't have to cancel the next day. And if we got nothing, that, on a Monday, we have enough. And if Tuesday we don't have it in, on Monday, we'll let everybody coming on Tuesday know that, they're going to have to reschedule. So it's a very fine balance. But as we open up more and more, people can go to the region and they will probably get, right now, Pfizer or Moderna, but AstraZeneca seems to be a fairly consistent supply. So I can't predict in the future. And people don't get to choose. So when you show up at a region of Waterloo clinic, you get whatever they're giving that day.
Yeah, I had heard somebody had said to me, oh, where are you getting it done? And I said, oh, at Rona, the old Rona store. And they said, oh yeah, they were there the day before and they got Moderna. And I said, yeah, well, whatever. I don't really care. I just said, I'm going to roll up my sleeve, and I kind of care what you're putting in my arm, but as long as it's a vaccine that's supposed to fight COVID-19, I'm happy with it. But when I got there just before, and I didn't even ask, she just said, oh, by the way, I'm giving you the Pfizer vaccine. So I said, well, yeah, whatever, no problem. I just hope they don't mix it, like, going forward. Like,
no, they won't. And if we're pretty consistent. And I mean, that's one of the reasons why we have this computer system to track everybody, that my next shot needs to be the AstraZeneca. Yours should be the Pfizer.
Yeah.
They haven't done clinical trials on mixing them. And another partner from the community who's been outstanding is Kelly Grinrod. Dr. Grinrod is with the School of Pharmacy, and she has debunked so many myths about the vaccines. And what she would say is any vaccine you can get is the right vaccine, because they all are incredibly effective of keeping you out of hospital. And if you get COVID, it's a much milder case. And I also just want to do the public health announcement here is, even after you get your vaccine and after it's taken effect, you still need to practice the public health guidance of wear a mask, physically distance, stay home if you're sick, get tested if you have symptoms. Because these variants of concern, is if you go on our dashboard on our website and look, are definitely on the rise.
Yeah. It's not just a license to go and do what you want to do anymore. We gotta protect each other, and part of that is those of us who have got a vaccine shot. We have an obligation to keep others protected who have not yet. So we need to do our part.
And Greg, and another really, Sharon Ball's been amazing from Cambridge North Dumfries, Ontario Health Unit. And Lee Fairclough has been our lead for hospitals. And some people are a little taken aback when they're now hearing about patients being moved from jurisdiction to jurisdiction, but that's always been the case. And if we were overloaded, we would send our patients somewhere else. So the province very much looks at the hospital system as a healthcare system. And when you hear patients they call it decanted to other areas, that's not that unusual. That has always been, and actually our paramedics are part of a group that are helping facilitate that. There's 5 different paramedic units that are making sure that if patients need to go from point A to point B, they're done safely.
That's great. Yes, the pharmacy vaccinations are being included in the numbers reported by public health. No?
Not at this point. We keep asking, and it's interesting because one of the articles in the newspaper said they can't understand why we're asking for those numbers and we have not received them. We don't report numbers that we don't know are accurate. Apparently, there is one other health unit that has done that, and we keep asking for the numbers that have been delivered to pharmacies. So you'll see a spike in the 120,000 that once those numbers come in.
That's awesome. Well, we're going to have to leave it there. Everybody's got to get to work and make some money if they possibly can. Karen Redman, I can't thank you enough personally for the leadership of yourself in the region of Waterloo and your council, and everyone who's trying to help businesses navigate through here, through this crazy time. You're such a gracious individual with your time for us here at the Chamber, and we appreciate you every single day. So thank you very much.
Thank you. It's a great team.
Okay. Have a great day, folks.
Stay safe.